What is up, guys? Dr. Shepard here, and I want to talk to you today a little bit off the cuff about what strategies I use to manage anxiety in my patients and honestly in myself. If you like some of the stuff we talk about and you're interested in these topics, please consider liking this video and most importantly, hitting subscribe, pushing the notifications bell so you get notified every time I post a new video. It's super helpful to have subscribers. It really helps support me and helps me know what you guys are interested in. So here we go. There are about 4 billion anxiety management strategies out there. And you kind of just got to find what works for you. I'm sorry for saying that. But that being said, there are some that are more effective and more helpful than others. And so I'm going to talk to you about what I found to be generally the most helpful and what strategies are kind of more supported by research evidence. So hopefully you don't have to try as many things. But out of the things that I recommend to you, some of them may work well for you and some of them may not. So you're going to have to try some of these strategies. You're also going to have to try them more than once. Most of these things are not going to help right away, which kind of sucks, but I mean, I'm just being honest with you guys. But don't give up. If it's not helping, keep working at it, and eventually something will help. All right, so starting off with the Cornerstone. I think for most people that suffer from mild anxiety, they can use sort of these tips and tricks to get them through. But if you have severe anxiety, and by severe anxiety, I mean something that's impacting your day-to-day ability to function, or something that is just like there all the time and is super uncomfortable and you are really struggling, then the cornerstone for you is going to be therapy and or medications. These are by far the most effective 2 strategies for dealing with anxiety. And honestly, if you have severe anxiety, the strategies that I go on to talk about are not going to be that effective for you because your brain simply can't learn and implement these strategies if you are severely anxious. So if you're really struggling, I think the first step is to talk to a doctor. Can be your primary care doctor, your psychiatrist, or getting a psychiatrist that you can talk to, and or a therapist, of course, to kind of help talk you through some of this and help you figure out whether therapy, medications, combination of both is going to be the best thing for you. All right, so first strategy that I use to manage my own anxiety for sure, and something that I really recommend to my patients, is exercise. Hopefully you can find something that you enjoy doing. Something that's going to get your heart rate up is really ideal. You also it's kind of a nice way to like discharge all that anxious energy that you have. I started exercising regularly when I was in college, and I did it because I wanted to be healthier and, just felt like it was a good thing to do. But I wasn't anticipating the impact that it would have on my mental health. I think that was huge. And I noticed like if I can't work out for a period of time due to an injury or just stuff going on in my life, it is so much harder for me to manage my stress and anxiety levels than it is when I'm regularly exercising. For me, this looks like a combination of cardio and weightlifting, and that really works well for me. There's a bunch of different reasons why exercise is so effective, and of course, the physical health of your body is going to impact your mental health, but it's also a bunch of other little benefits that you don't think about. So when you're exercising, you are setting a goal and reaching it. That's actually really helpful for anxiety. It boosts your confidence. When you are exercising, you are going to be sleeping better, which is going to help with your anxiety. You oftentimes start eating a little bit better when you're exercising, which is another thing that can help with anxiety. You also expose yourself to some pretty uncomfortable physical sensations during exercise. So anxiety oftentimes is compounded by the discomfort of different physical sensations that you might get. So If I'm having a panic attack and I feel like my chest is tight and I can't breathe, or I feel like my heart is racing, then I say, oh my gosh, this is so uncomfortable. I'm so freaked out. This means my anxiety is getting worse. If you exercise and induce that fast heart rate in yourself and induce that shallow breathing in yourself, you start to get used to those sensations and they become a little bit less scary when you have them in the context of anxiety. All that to say that exercise is super helpful in a variety of ways. And I'm talking about it first because it's honestly been the biggest game changer in my own personal life for stress and anxiety management. All right, so second anxiety management tip that I have for you is going to be to be anxious and do it anyways. Again, I know it's easier said than done, but it's super important. Anxiety is actually really good at getting us to not do the thing that we are afraid of. So it's gonna pop up more and more when you are doing something that you're scared of. And if anxiety knows that you're going to listen to it and do what it says, it's going to get worse. So what you have to do is know that you are going to have anxiety and do the thing that you're anxious about anyways. So for example, if I'm anxious about giving speeches, I might get clammy and freaked out and have a horrible panic attack before I give my speech. But if I go and do it anyways, I teach myself that the anxiety doesn't dictate what I do. In that case, the anxiety might rise right before that speech and it might be really uncomfortable. But in the long run, what you're teaching yourself is that your anxiety symptoms are not actually something you always have to pay attention to, which is really important in those of us who struggle with anxiety because we are very sensitive to anxiety and we use it as a sign all the time that we should pull back on what's important to us. So I want to tell you, when you are anxious, that's a sign that you need to go for it. You need to do the thing you're anxious about and teach yourself that anxiety is actually not the best predictor of how you're going to do. This is also important not just in reducing your anxiety levels long term, but it's also really important in not allowing your life to become very closed off and very small. So even if you have anxiety, you can live a full and good life and you can do the things you want to do. But the only way that you can do that is by not allowing the anxiety to dictate your every move. Third anxiety management tip that I use is mindfulness. Mindfulness is huge. And the reason that mindfulness is so great for people with anxiety is it helps you get some distance from your thoughts. So when we practice mindfulness, we practice observing our thoughts and we practice not judging them. And when we do that, we're able to get a little bit of space from our thoughts. So we're able to kind of realize that they don't hold as much power as we think. So for example, someone who's very hooked into their thoughts, if they have the thought, I'm afraid of driving because I might have a panic attack and I might crash my car, they're going to get very upset about that thought and very freaked out about that thought, and it's going to probably induce a panic attack when they're driving. Somebody who has a little bit more distance from their thoughts and is able to be a little bit more mindful of their thoughts is going to notice that they're saying those things, identify that thought pattern, label it as a thought, and then they have that little bit of space where they're able to decide, okay, is this thought true and is it helpful? And if it's not, they're able to, with a lot of practice, sort of let the thought go and replace it with something that is a little bit more helpful. So mindfulness can be done through sort of a more formal practice, which could involve like 5 minutes of mindful meditation every day. And if this is something you guys want to talk more about how to establish, let me know in the comments and we can talk more about it. There's lots of other really good guides on YouTube. Or it could just be an informal mindfulness practice. And that's something that's going to involve just sort of paying attention to your surroundings. For me, I found that if I'm driving to work and I make a mental note to pull myself back to the present moment every time I'm at a stoplight, that can be really helpful. I find that establishing a formal practice when you're kind of new at this really helps speed up the process. But again, informal is better than nothing. The other thing that I kind of just alluded to is that mindfulness can really help center you in the present. And oftentimes when we are anxious, we're really focused on the future. We might also be focused on the past, but honestly, if you're truly centered in the present, you're probably not going to be anxious, because usually the thing that we're afraid of isn't actively happening. There are, of course, some cases where that is true, but for the vast majority of cases, if I'm anxious about something, it's because I'm envisioning something happening in the future. So mindfulness, in addition to teaching you to gain some distance from your thoughts and to gain some more objectivity with your thoughts, it also teaches you to kind of remain in the present moment, where usually you're okay, things are okay. I found that the more that I can stay in the present moment and notice when my mind is drifting off into the future, the more I realize that all of these things that I'm like catastrophically imagining happening are actually really unlikely, or really things that I'm able to actually cope with more than I would think I am. Okay, so anxiety strategy number 4 is going to be good old distraction. So when you are feeling super anxious and super worked up, I want you to go and do something. So it may be really tempting to just lay in your bed and think about how anxious you are because you feel like you can't concentrate on anything anyways. But what you can do is get up and do something else. If your mind is occupied, you're not able to worry as easily. So it's kind of a way of teaching yourself, again, that the anxiety isn't all that important to you and that you don't have to listen to it. Find something, it can be really simple, like, just trying to watch a TV show or going for a walk or calling a friend, something like that, to help distract yourself from some of the anxiety you're feeling. You will notice, and it may not be in real time either, but you will notice eventually the anxiety does go away, or it gets at least a little bit better, so you get a little bit of reprieve from that. And distraction can really help speed up this process. All right, number 5. We kind of hinted at this a little bit earlier when we talked about mindfulness, but I find that acceptance of anxiety is super helpful. So just know that everybody has anxiety. I'm a doctor, I'm a psychiatrist, I'm theoretically really good at this mental health stuff. I still get super anxious sometimes, and that's okay. In a lot of ways, anxiety is actually a protective thing. It's meant to help us. It's not meant to hurt us. And if you can kind of change your relationship with your anxiety a little bit, kind of being able to appreciate it more and being able to be kind to it more, it helps actually kind of diffuse it a bit. So when you're upset about your anxiety, when you're trying to avoid your anxiety, it's going to be way more difficult to actually get through it. Whatever we try to resist persists. So if you are trying to actively push away your anxiety instead of accepting it, guess what? You're going to end up with more anxiety. All right, so last point is to use CBT techniques to kind of work through your anxiety. And this is something that we'll teach you in therapy if you decide to come and do some therapy. But there are also a lot of good online resources that you can use to help teach yourself some of these techniques. So one thing that I find really helpful with anxiety is to challenge your thoughts. And the reason this is helpful is because those of us with anxiety tend to catastrophize. And what that means is you're basically thinking that things are worse than they are, or thinking that things will be more horrible, or thinking that the worst case scenario will happen, or thinking that if the worst case scenario happens, you're not going to be able to handle it. And it kind of snowballs into this very dramatic thing. So if you are a catastrophizer, then what you can do is challenge those catastrophic thoughts. So I'll give you a real life example that happened to me really recently. I was being an idiot and I threw a ball over my fence by accident, and I decided that instead of walking the extra 5 feet to go to the gate and get around it and get the ball, I was gonna jump over the fence. And that should have been fine. It's not even that tall of a fence, it's 5 foot tall. But my graceful self careened over it, landed just right on my ankle, and I really hurt it. I mean, it was like really hurting for a couple days. I went through a series of catastrophic thoughts. So my first thought was, oh my God, I broke my ankle. I'm never gonna be able to work out for like a year, and it's gonna be horrible, and my mood's gonna drop, and I'm gonna feel horrible, and I'm gonna be so anxious, and it's gonna be awful, and I'm gonna lose all my muscle that I gained. And then I decided, no, it's not broken because I can walk on it. So, oh my God, I tore my Achilles. I'm gonna have to have surgery. This is gonna be so expensive. I have a really high deductible. Oh my God, this is awful. I'm never gonna be able to work out again. My career as a mediocre exerciser is very limited and in danger. Anyways, you can see it's kind of ridiculous. So fast forward to 2 weeks later, I really didn't need any treatment, and it just kind of got better on its own, and I'm almost back to my full exercise routine. The time that I wasted catastrophizing, useless. Anyways, so whenever I get into a catastrophic thought pattern like that, I try my best and file it away once I prove to myself that I was being ridiculous, so that I can remember it for future times when I careen off a fence and land on my ankle wrong and start to catastrophize. Anyways, so there are other types of CBT techniques that you can absolutely use for working with anxiety. I find that if you write these things down and kind of practice them almost like you're doing a workbook or something, that can be pretty helpful. And if you guys are interested, I can do more videos on different CBT techniques that we use to manage anxiety and depression. But hopefully these tips have been helpful. If there's anything you want to learn more about, let me know in the comments, and I will see you guys later.